When you look at cancer in a disease state today, it's becoming more of a chronic disease instead of a death sentence. And with the patient navigation program, what we're able to do is follow that patient from diagnosis through treatment, but more critically, post-treatment throughout their survivorship. It also maintains the patient then as the center of the care being given.
I was diagnosed with stage 3B colorectal cancer. It was in my lymph nodes. It had spread to adjoining organs. To say the least, I was scared to death. So then I was introduced to Kim Shank. She is a nurse navigator at Memorial Hospital.
The colorectal navigation program started in January of 2011, and it really started from us identifying that patients that are diagnosed with cancer all of a sudden have a lot of issues and needs that they just need help with.
She accompanied me to doctor's appointments. She helped me through emotional issues. She answered extremely private questions that I couldn't feel as though I could just ask anyone.
Patients get admitted, they get treated, and they get released. But it's all these things that happen when the patient's not in the hospital that become crucial to their overall care.
Patients can have upwards of anywhere between 4 to 5 specialists and subspecialists that the care has to be coordinated between, and that's where the nurse navigation comes into play.
So I'm kind of here to reinforce what the physicians and the inpatient nurses are asking the patient to do. When I get here, the first thing I generally do is I'll check in with any of my patients that are inpatient, post-surgery. I'll go to the floor and I'll visit with them, kind of check on how they're feeling and doing. Are they participating in their plan of care? Encouraging them to get up and move and educating on why that's important. Then a lot of my time is spent on the phone checking in with patients, especially my patients that are on chemotherapy, radiation. I will check in on them on a regular basis to hopefully assess if there's any side effects that are starting to be developed. I also do a lot of communicating with all the other physicians that are on the patient's team, making sure that all the physicians are aware of what's going on with their patients.
There is communication that goes on between the nurse navigator and the primary care physician. That it is a critical piece, and it does keep the primary care physician involved with where the patient is in the treatment process.
What this program also does is bring in a population health specialist that extends that nurse's clinical care to where she can focus on the clinical side, and the population health specialist can focus on what's new for the patient that's non-clinical.
In our heart failure program, the population health specialist gets involved very early, actually. They meet the patient early in their admission to enroll them in the program. And what they begin to do is build a database on the patient about who their primary care provider is, their cardiologist, their ER visits, their clinic visits, their home health liaisons, and all these things that are usually a non-directional cycle for the patient. Right? Your cardiologist is different from your primary care provider, is different from your ER visit, is different from your hospitalist that takes care of you, is different from your home health provider.
We expect the program to work for our CHF patients because they leave our facility with discharge instructions and prescriptions, and they don't make their follow-up appointment because they can't get a ride, or they don't have a family member to take them. They can't get to the pharmacy to pick up their prescriptions because maybe they don't have the money.
Then all these different people become very confusing. Well, the population health specialist has the resources to say to the patient, well, let me see if there are medication assistance programs that can help you with that. And also, let me see if your local church or some community support group has funds to help you pay for your electric bill so you can get your medicines. And maybe I'll call the electric company as well and see if they have any programs that will help you spread your payments out or do something to help relieve that burden so that you can get your medications. But this becomes one source, one resource that a patient can contact for a non-clinical health system navigation, and it becomes much more than that. There are benefits to the patient, there are benefits to me as the provider, and there are a lot of benefits actually to the health system overall.
TAV Connect is the program that we use and that we have offered to and have implemented in oncology that specifically follows a patient from the very beginning of enrolling a patient into the program all the way to what we would hope, of course, is survivorship. Any of the specific information that is necessary is then placed into this program, is tracked for them, and then over time they can see what their total outcome is for many different patients all at the same time or just one specifically.
The other powerful aspect of the program through TAV Connect is looking at our quality metrics. We've looked at when we started till now, and we've taken the time from referral of diagnosis to surgery from 30 days down to 7 days within colorectal. Within our lung program, from the time of diagnosis to getting them in to see either a medical oncologist or radiation oncologist, we've reduced that down from 3 weeks down to 1 week now.
When TAV Health first came to the oncology program, one of the things we found first is that most of their processes were very manual. What we've now provided with TAV Connect is the ability to not only keep information in one place, but then over time be able to connect with both the patient and the physician more efficiently.
When I look at the program and what TAV Connect can offer to me in my leadership role and management over the nurse navigators and the population health specialist, it gives me some unique tools. I'm able to track the number of patients and the locations that they're coming from. I'm able to track the secondary and tertiary markets that we're pulling physician touches of those patients and families. Our program is growing, and as it grows, one of the hurdles again is scalability, and that's where the population health specialists can come in and allow us, where we would have stopped at 40 patients, we're able to go up now as high as 125.
I think it's critical that the hospitals continue to fund the nurse navigation program here at Memorial, and I can tell you there's been a significant decrease in the length of stay.
About 500,000 people each year are diagnosed with heart failure. Those are huge statistics, and if we can keep those patients at home, out of the hospital, and navigate better treatment for them so that their quality of life is better, you can't put a price tag on that.
With declining revenues and changes within healthcare, this program is vital to the hospitals, and the fact that if we can stop one readmission or stop 1 or 2 unnecessary returns to the ER, we're able to quantify that and look at the return as a program for what we can do with the patients.
Now, when you look at a hospital like Memorial, decreasing the heart failure length of stay by a day can equal up to maybe 400 to 500 hospital days.
It's made my time more efficient. I've been able to see more patients in a shorter amount of time because I'm dealing with more pertinent questions and more pertinent issues.
And simply that customer service aspect and then improving their care will automatically ripple out to the patients, their families, their neighbors, their loved ones, and the primary care providers, and the whole system becomes stronger.
No longer is it just the surgeon or just the hospital, but it's a team approach to the treatment of cancer. And we're seeing that way as more of a unified front rather than two separate institutions giving care to one patient.
Because we are able to offer things to patients well beyond just the care in the hospital, it brings them back full circle, them and their family both, to hopefully bring them back right into the Memorial systems.
Patient satisfaction, I feel, is directly related to their nurse navigators. The fact that they know that Memorial has invested in this program means a lot to them and their family. The fact that they are not billed or charged in any way for this program, they have access to a nurse that can answer questions and help provide support.
I got a friend in my navigator. Less than a month ago, we found out that my father has bladder cancer and kidney cancer. And when he got that diagnosis, the first thing I did was I called my nurse navigator. And in urology, they have a nurse navigator there. It's a blessing for me. I don't know what we would do without them. I don't. As I see other patients that are going through the cancer journey right now, and they're so lost. They're so lost. And I want to tell them so bad, please come to my hospital, because they have navigators and they'll call you when you've had chemo and you're down. I really don't know why all hospitals or medical facilities don't have something like the nurse navigation program. When you're told you have cancer, you want help. You might not admit it, but you want help. And I'm so glad I had a navigator to help me.